I'm sure we all know what a placebo is, an intervention that with no physiological effect, at least measured in a scientific study, the client or the subject of the study can still experience a positive value. Outside of a scientific environment or a scientific laboratory, though, really a placebo doesn't exist, right? Because we really don't have a way to differentiate what created the positive experience when we're in the clinic. So I think it's really important to do that. A lot of times, if you're a scientist, you're looking at a placebo as maybe a negative thing because it showed you that the intervention you were testing might have not been as useful as you thought if the placebo also created a positive effect. But in a clinical environment, we're looking for the positive experience. So positive words matter, and we want to put people in a situation where again they feel empowered and they feel curious more than they feel afraid. And then the reverse would be the nocebo effect, where you can create a detrimental health effect due to psychological factors such as negative expectations. So I'd say this is the number one thing in the last like decade that I've been fighting with my clients. Is just they all have people that they see. They all have their psychologists, their physicians. That usually my clients have many physicians, and they're getting told different things. And as soon as the negative talk starts coming up, telling people that they're deteriorating, they're breaking down, they got bodies like an 80-year-old when they're in their 50s, it's really hard to break that. And then, they're told all the time that they basically shouldn't do the things that I'm trying to help them do.